Some interesting data that just came out of the CDC. It has a lot of people talking, and to set this up, it is so important. We have to go back to July of 2021 to then CDC Director Robert Redfield. He went on an interview and he said some very interesting things. Take a listen.
All right.
There has been another cost that we've seen, particularly in high schools. We're seeing, sadly, far greater suicides now than we are deaths from COVID. We're seeing far greater deaths from drug overdose that are above excess, that what we had as background, than we are seeing deaths from COVID.
Yeah, so I remember talking about that. So where are we at now?
Yeah. So the CDC just released a report. It's in their MMWR. That's kind of like their in-house science journal. We've covered so many stories on there. It's been highly politicized during this COVID pandemic. But these are the results of the lockdowns. We're talking lockdowns here. Mental health, suicidality, and connectedness among high school students during the COVID-19 pandemic. This is a survey in the United States from January to June of 2021. What did they find? This is the CDC's journal reporting this. They found this. Overall, 37.1% of students experienced poor mental health during the pandemic. It also goes on to say, in addition, during the 12 months before the survey, that was still lockdown, 44.2% experienced persistent feelings of sadness or hopelessness. 19.9% had seriously considered attempting suicide. 9% had attempted suicide. These are horrific numbers, Del. And, we bang on this. I know it's not happy news to talk about, but my gosh. So how could we have seen this coming? Well, we have the actual CDC director, Robert Redfield, signaling this in July of 2021. But even before that, we have the signatories on October 25th, 2020, of the Great Barrington Declaration, literally in their first 3 sentences of the declaration, they found it was so important. They put this: the Great Barrington Declaration. As infectious disease epidemiologists and public health scientists, we have grave concern about the damaging physical and mental health impacts of the prevailing COVID-19 policies. They were seeing all the lockdown policies going, and they said the results, to name a few, include deteriorating mental health, leading to greater excess mortality in years to come, with the working class and younger members of society carrying the heaviest burden. Keeping students out of school is a grave injustice. And that's what Redfield was talking about in that clip. He was saying we need to open these schools. We need to find common ground, because this is what's happening now. And this is what the Great Barrington Declaration signatories said what was going to happen.
And looking at that, Jeffrey, just to interject really quickly, remember we covered, and you covered the fact that when that Great Barrington Declaration came out, and in the face of Rochelle Walensky now touring the world and saying, hey, the science is gray. When we said we're following the science, it didn't mean it was black and white. We were just finding our way. It changes. Well, if that was the case, why weren't you open to the Great Barrington Declaration? And instead of bringing those epidemiologists and world-renowned scientists to the table to have a conversation, to see if there would be more casualties from this decision, instead we had reported that the head of the NIH, Francis Collins, in an email that was captured in a FOIA request, showed that he immediately said, we need to take these people out, destroy them, basically. The sweet old Francis Collins that plays banjo like Kermit the Frog was out there trying to destroy scientists that were warning us of an epidemic of suicide and depression, amongst other things that would be caused by measures that, as they said, would not work. And now, where are we at? Did they work?
Absolutely not. And remember, Francis Collins was calling for a quick and devastating takedown. Those were his words of 3 fringe epidemiologists of the Great Barrington Declaration. That was to Tony Fauci. Tony Fauci immediately went on the news. He was the mastermind behind articles. He was the attack dog that tried to shut this conversation down. So now we see headlines that look like this. This is out of the UK. Why more and more experts say lockdown didn't prevent people from dying and call it a monumental mistake on a global scale. And remember, this study, this is out of Johns Hopkins, a literature review, a meta-analysis of the effects of lockdowns on COVID-19 mortality. This was just at the beginning of 2022. It was released. Basically the most comprehensive look at lockdowns. It says this: while this meta-analysis concludes that lockdowns have had little to no public health effects, they have imposed enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. They go on to say these costs to society must be compared to the benefits of lockdown, which our meta-analysis has shown are marginal at best. Such a standard benefit cost calculation leads to a strong conclusion. Lockdown should be rejected out of hand as a pandemic policy instrument. And why are we talking about this? Well, we're seeing, drum beats around the world. Del, you and I talked for the show here. Shanghai is locking down 25 million of its residents. It's not quite clear that this COVID thing is really in the past and lockdowns are in the past. So we need to keep hammering this home. But just to cap this segment off, literally the number one I'm not going to call him architect, but Tony Fauci, the cheerleader for these lockdowns in the media throughout the last 2 years, he was recently interviewed and asked about them. Hold on to your socks. Listen to what he had to say.
I'm interested in your reluctance to use the word lockdown. Do you think 2 years on that they were worth it, or were they too severe?
I don't think we're ever going to be able to determine what the right balance is. I think the restrictions, if you want to use that word, which I tend to shy away from, lockdown, there's certainly prevented a lot of infections, prevented a lot of hospitalizations, and prevented a lot of deaths. There's no doubt about that. Obviously, when you do have that kind of restriction on society, there are unintended negative consequences, particularly in children who are not allowed to go to school, in the psychological and mental health aspects it has on children, in the economic stress that it puts on society in general, on individual families. Obviously, those are negative consequences that are unintended.
I mean, he's even, half right there when he says, there's no doubt they worked. In fact, Johns Hopkins, John Ioannidis, every study, meta-analysis of all the studies around the world are showing, as they said right there in Johns Hopkins, negligible, if at all. So there were no benefits. There was only negative effects by this, and yet he's out there. At least he's admitting we'll never really know. A good scientist should be able to know. Good data collection would have led us to those answers. And this entire heaping, steaming, stinking mess that was caused by Anthony Fauci, the fact that we have to listen to this guy anymore in the news at all, it's astounding. If anyone out there, I'm sure you're not watching my show, think this guy is a hero, I'll have you know, I will never give up until I see that man in prison.
You don't have your little Fauci candle burning right off camera there?
I don't, no.